scientific revolution was not limited to astronomy and mechanics in the 16th and 17th centuries, which your book goes into great detail, examining how scientists, philosophers, went from a geocentric viewpoint of the world, being that the universe was Earth-centered, to a heliocentric universe, sun-centered. This lecture we're going to be looking at the field of medicine, because during the scientific revolution that field is going to undergo dramatic change, and they're taking the ideas, just as the scientists of the scientific revolution took the ideas of ancient Greeks. The medical world did too, and it dates all the way back to a Greek physician by the name of Galen. Galen, he was Greek, but he lived and worked in the Roman Empire. Galen ascended high. After working with gladiators for a considerable time, he's going to come into the service as a primary physician and friend to the Emperor Marcus Aurelius, who reigned over the Roman Empire from 161 to 180. He was the last of the 5 good emperors. And Galen, his influence on the medieval medical world, which moves into modernity, it was pervasive in anatomy, physiology, and disease. Galen had relied on animal rather than human dissection to arrive at a picture of human anatomy, and of course it's going to be quite inaccurate in a lot of instances. So when Europeans began to practice human dissection in later medieval ages, that was in the mid-1300s, as a result of the Black Death had entered Europe and the Pope lifted the sanction on human dissections. Instruction in anatomy, even with that, they still relied on Galen. And in medical colleges, they're very crude, they're very not sophisticated. A professor would read a text of Galen, an assistant then would dissect a cadaver for illustrative purposes, and physiology, or the functioning of the human body, that was also dominated by Galen, and that included the belief that there were 2 separate blood systems. Galen argued that one controlled muscular activities, and it contained bright red blood, and it moved upward and downward through the arteries. And the other blood system, it governed the digestive functions, and it contained dark red blood that ebbed and flowed into the veins. Treatment of disease, also highly influenced by Galen's doctrine of what's known as the 4 bodily humors. You had blood, yellow bile, phlegm, and black bile. And so the body contained these 4 substances, these humors, and when you had an excess or a shortage of any of these substances, it would result in an illness. And the best cure then was to let out some of it, and that was through bloodletting. That was very popular. And also, since disease was supposedly the result of an imbalance of the humors, and you can discern that by examining the patient's urine. You examine, every king had a physician in his royal court that it was his job every morning to examine what they called the king's water. And his job was to look at the quantity, the odor, the color, if there's any floaties in the urine, and then lastly to taste it. And that was to determine how much salt could possibly be in that urine. Purging was also used, but bleeding was really one of the more common remedies to benefit the patient and to release some of those humors if there was too much. Of course, too, when you're some of these physicians, when they release too much, they're also releasing blood white cells, which could it's the white blood cells that go after infections and viruses. So now 3 figures associated with the changes in medicine in the 16th and 17th centuries were Paracelsus, Andreas Vesalius, and William Harvey, and that's what we're going to be looking at here, these three individuals. Paracelsus, his real name was Philippus Aurelius von Hohenheim. He renamed himself Paracelsus, means greater than Celsus. Celsus was actually an ancient physician, well respected, and Paracelsus says, I'm better than him. So he was born in a small town near Zurich. He left home at the age of 14, traveled widely, may have been awarded a medical degree from the University of Ferrara. He does achieve a moment of glory when he's appointed city physician and professor of medicine in 1527 at Basel. But his appointment at Basel, like so many others, are going to prove to be short-lived, and that's due to his vanity and his quick temper. He could never disguise his contempt for universities and physicians who did not agree with his new ideas. He was not easy to get along with, and he's forced to wander from one town to another until his death in 1541. But Paracelsus and his followers, because he does have some followers that agree with him, they hope to replace the traditional system with a new chemical philosophy that's based on new understanding of nature derived from fresh observation and experiment. So Paracelsus is going against this imbalance of the four bodily humors. He says disease is not caused by that. It's due to a chemical imbalance, and it could be treated with chemical remedies. Now, others had used chemical remedies, but Paracelsus differed from them. He gave careful attention to the proper dosage of their chemically prepared metals and minerals, and Paracelsus he believed that the poison that caused a disease would be its cure if it was used in proper form and quantity. So he argued that contraries, that like cures like. So the use of toxic substances to cure patients, despite its effectiveness, Paracelsus, he did have a strong reputation for actually curing his patients. There were those who were, his opponents at that time. They referred to him as a homicide physician, but later generations are going to view Paracelsus more favorably. And historians, they have stressed that Paracelsus' concept of disease and his recognition of new drugs for medicine, they view him as the father of modern medicine. So historians usually associate the name of Paracelsus with the diagnosis and treatment of disease. But the new anatomy of the 16th century, that's going to be the work of Andreas Vesalius. His study of medicine, he studies at Paris. Of course, in medical school, all students are looking at the works of Galen. And Vesalius, he emphasized practical research as the principal avenue for understanding human anatomy. He receives a doctorate of medicine at the University of Padua in 1536, and he accepted a position there as professor of surgery. And in 1543, this is when he publishes his masterpiece on the fabric of the human body. So this book was based on his lectures. And he's deviating from traditional practice. He's personally dissecting a body to illustrate what he's discussing. He's not sitting up at a podium where an assistant, a barber surgeon, dissects the corpse. So Vesalius, he presents a careful examination of the individual organs and the general structure of the human body. And the book, it would not have been feasible without both the artistic advances of the Renaissance and the technical developments in the art of printing. And together, they made possible the creation of illustrations superior to any produced there. And this is the front piece of his book. And as you can see here, it's very detailed. I find it rather ironic, a skeleton examining a skull at a podium. Then we have where he illustrates the nervous system, and he labels everything with this illustration. And in this illustration, he's showing how muscle tissue, tendons, ligaments, how they all connect to the bone. And not only is this corpse kind of falling apart and peeling away, but he's also leaning against this crumbling wall, which is also kind of falling apart. It's not just a standalone figure here. This illustration shows the muscles, and in the background you've got a little village in the background. And then finally we've got the blood systems. Now Vesalius did stay with that principle of Galen that there were two separate blood systems. He did not disagree with that. But it's not going to, his work, of course, is groundbreaking. An accurate depiction of the human body, of the physiology of the human body. But it's not going to be until the work of William Harvey that the circulation of the blood, those misperceptions are going to be corrected. And William Harvey, Englishman, he attended Cambridge University. Later he goes to Padua, where he received a doctorate in medicine in 1602. He's going to be appointed physician to St. Bartholomew's Hospital in 1609. And later he became physician to two kings, King James I and Charles I. His reputation, though, is not because he was a physician to kings. It's because of his book On the Motion of the Heart and Blood, which is published in 1628. Harvey's work, which was based upon meticulous observation and experiments, it demolished the ancient work of the Greek Galen. And again, Galen had relied on animal rather than human dissection to arrive at a picture of human anatomy. Harvey demonstrated that, and Galen argued that it's the liver that's the source of blood. That's where all your blood starts and ends. But Harvey demonstrated that the heart and not the liver was the beginning point of circulation of the blood in the body, and that same blood flows in both veins and arteries, and more importantly, that the blood makes a complete circuit as it passes throughout the body. Now, although Harvey's work was dealt a severe blow to Galen's theories, his ideas don't begin to receive general recognition until the 1660s, and that's when capillaries are discovered, and it explains how the blood passed from arteries to the veins. And Harvey's theory of circulation of the blood laid the foundation for modern physiology. Now, another Englishman by the name of Sir Francis Bacon, some of you guys may know of him, your book talks about him, but Bacon is responsible for developing the scientific method. If any of you guys have taken science classes where there's labs, you have to, perform these experiments using the scientific method. You have to form a hypothesis. You then test that hypothesis. You analyze your results. You record everything, and then you determine if that hypothesis is correct or not. And if it's not, you got to discard it and start all over again. But Bacon also, he was very much involved in sharing information. He was a supporter of scientific research that advocated the establishment of learned scientific societies and practical colleges. So royal and noble patrons supported the enterprise by paying some of the costs of equipment and experimentation. Royal observatories were created for astronomers, like the Royal Observatory in Greenwich, which is located in London. It was commissioned by King Charles II in 1675, hence then they could put royal in the title. Also, you had colleges of physicians and doctors that were established, laboratories for chemists, and both England and France and the German states will eventually form societies. The English, they formed the English Royal Society. It came out of informal gatherings of scientists at London and Oxford in the 1640s, and it's going to receive a formal charter from King Charles II in 1662. Again, then they can put royal into the title. So science, they believe, could provide the knowledge to build better boats, maps, navigation, military guns. Remember, at this time, they're exploring the new territories, the new worlds of North and South America. They also believed science could help society and serve God as well as king and queens. Many members of the English Royal Society were Puritans, and they believed science was a means to glorify God. They were proponents of education. So now the French are also going to form their own society, and that again arose out of informal scientific meetings in Paris during the 1650s. And in 1666, Louis XIV, the King of France, formally recognized the group. The French Academy received abundant state support. They remained under government control. Its members were appointed by the state. They were paid by the state. In contrast to the Royal Society of England, the Royal Society received little government encouragement. They didn't receive any kind of funding. They just had the king's approval. France is going to be very different. So they emphasize both the English and the French scientific societies. They emphasize the practical value of scientific research. And they build observatories, and the French example is going to be especially important as the model for the scientific societies established in the neighboring German states. German princes, city governments, they encouraged the foundation of small-scale scientific societies of their own. Most of them in the German states were also sponsored by governments, and they were mainly devoted to the betterment of the state. Examples today of scientific institutions which are supported by the government in the United States, well, NASA, as well as the Food and Drug Administration, protect our food supply, the CDC, Center for Disease Control. These are all funded by the federal government. So now these societies, they're going to make useful contributions to scientific knowledge in the second half of the 17th century, but their true significance arose from their example that science could proceed as a cooperative venture. Spread the knowledge. So scientific journals also contributed to the spread of ideas and the concept of cooperation. You had the French Journal des Savants that was published weekly beginning in 1665. It printed results of experiments as well as general scientific knowledge. Its format appealed to both scientists and educated public interested in the new science. Out of England, you had the Philosophical Transactions, and it was the English Royal Society that initiated in 1665. It published papers of its members and letters that were sent to them, and the audience was practicing scientists. The Philosophical Transactions, it became a prototype for the scholarly journals of later learned and academic societies, and then again as a crucial instrument for circulating news of scientific and academic activities. One interesting scientific journal was the Athenian Mercury. It was geared towards women, educated women that were interested in the new science. The articles were in a dialogue format, usually between 2, sometimes 3 people. It was believed that women could understand the content easier if it was in that form. And women could also, and at the back of the journal were advertisements where women could purchase equipment, scientific equipment for their use. And then you also had other people that found that there was an audience for this, and you had the Lady's Diary or the Women's Almanac that came out several years later. I think it was the third of these types of readings material that was geared towards women that were interested in new science. And women were interested. Your book talks about Margaret Cavendish. Her nickname was by her male peers was Mad Madge. Talked about Maria Winkelmann, a German astronomer, and the challenges that these women had to go through to do what they loved. So the nature and value of women had been the subject of ongoing centuries-long debate. It was known as the Querelles des Femmes, arguments about women. Male opinions in the debate were largely a carryover from medieval time. They're not favorable. Women were portrayed as inherently base, prone to vice, easily swayed, sexually insatiable. So, hence, men needed to be able to control them. Learned women were viewed as having overcome female liabilities to become like men. One man, in praise of a woman scholar, remarked that her writings were so good that you could, quote, would hardly believe they were done by a woman at all, end quote. And in the early modern era, women joined this debate by arguing against these male images of women. They argued that women also had rational minds, they could grow from education, and so how then did the era of scientific revolution affect this debate over the nature of women? Well, as an era of intellectual revolution in which traditional authorities were being overthrown, you might expect significant change in men's views of women. But by and large, instead of becoming an instrument for liberation, science was used to find new support for the old stereotypical views about a woman's place in the scheme of things, just what is her traditional role. An important project in the new anatomy of the 16th and 17th centuries was the attempt to illustrate the human body and skeleton. So for Vesalius, the portrayal of physical differences between males and females was limited to external bodily form, the outlines of the body and the sexual organs. Vesalius, he saw no difference in the skeletons and portrayed them, both women and men, as the same. It wasn't until the 18th century, in fact, that a new anatomy finally prevailed. You had drawings of female skeletons between 1630 and 1790 that varied, but females tended to have a larger pelvic area, and in some instances, female skulls were portrayed as smaller than those of males. So, 18th century studies on the anatomy and physiology of sexual differences provided what they said, and this is in quotation marks, scientific evidence to reaffirm the traditional inferiority of women. The larger pelvic area proved that women were meant to be childbearers, and the larger skull of the men demonstrated the superiority of the male mind. So, male-dominated science had been used to prove male social dominance. And at the same time, during the 17th and 18th centuries, women even lost the traditional spheres of influence they possessed, especially in the science-related art of midwifery. Women serving as midwives had traditionally been responsible for birthing. But the impact of the scientific revolution, it caused traditional crafts to be upgraded and then even professionalized as males took over. So when medical men entered that arena of birthing, this was quite controversial at this time. Some of them referred to as a man midwife. These men, they would begin to use devices and techniques derived from the study of anatomy, like the forceps, to help a woman deliver a baby. And these techniques, these devices, these tools were increasingly used to justify the male takeover of the traditional role of midwives. So by the end of the 18th century, midwives were simply accessories to the art that they had once controlled, except among the poor. Since little money was to be in serving the lower classes, midwives were allowed to continue to practice their traditional art among them. So overall, the scientific revolution reaffirmed traditional ideas about women. Male scientists used a new science to spread the view that women were inferior by nature. They were subordinate to men and suited by nature to play a domestic role as nurturing mothers.